Engagement Board. I think the last time we met, I think we were hopeful about whether we'd even be able to roll some of the work of this engagement board into the Health and Wellbeing Board. Although clearly, in terms of where we're at with cases rising and the various elements of vaccination and testing and stuff, it was felt that it was important that we held this meeting and we gave this the current point we're at in the pandemic in Reading the appropriate have this meeting to hold that. So welcome everyone, and thank you very much for joining us. I'm going to have to read. I think the first thing is to read this statement you've all heard lots of times about the fact that it's recorded, and I'm just going to try and find it. It's supposed to come up on my other computer. Just open up. Computer's opening up the document that's got the script that's been kindly given to me. So if it sounds like I'm very stiltedly reading a script, it's because I am. So this is about online meetings. So I'd like to inform everyone present that this meeting will be recorded in Microsoft Teams and then will be uploaded and available for repeat viewing on the Council's website. Councillors, officers and partners attending will be asked to introduce themselves if they speak at the meeting. To help me manage the meeting, if any members of the board wish to speak during the meeting, please can you indicate your wish to speak in the chat section of your screen and then wait to be called. This will avoid us talking over each other, but everyone's always very well behaved in this meeting. When not speaking, all attendees should put their microphones on mute and switch off their cameras. When called to speak, please switch on your camera, unmute your microphone and pause for about 3 seconds to allow for the slight time delay in connection. If you're addressing the meeting, it would be best if you can have your camera on so that people can see who is speaking. However, we are aware that we're at the mercy of individuals' broadband services, so it is possible that loss of connection can happen, or if your connection is poor, you may find that it improves if you turn your camera off, and so we'll understand if this is necessary. Thank you. So the first item is apologies. Nikki, do we have apologies for the meeting?
Chair, I've had apologies from Mandeep Baines and David Shepherd from Healthwatch, Francis Martin and Shona Douglas from the Council, Meredith Peachy, the Director, Paul Illman from Royal Berkshire Fire and Rescue Service, but Gail's Muirhead's here instead, all the colleagues from the Royal Berkshire Hospital, and I think Councillor Brock is on holiday, isn't he?
He is, yeah, he's away.
Yeah, so
okay.
I think that's all I've had. I don't know if you've had any other councillors or anything.
I haven't, so I don't hear anyone else indicating they've got any apologies to pass on, so thank you very much for that. Nikki, in which case we move on to the minutes of the meeting held on the 23rd of April. I'm not planning on going through the minutes. Hopefully everyone's had a copy, maybe have some in front of them and has read them. Does anyone have anything they wish to raise, any particular point or any accuracy they wish to raise from the minutes of the previous meeting? Now's the time to indicate, because otherwise we'll sign those off as being correct. So I'm not seeing anybody indicating, in which case, thank you, we'll sign those minutes off. The next item is questions from members of the public. I don't believe we have any, do we, Nikki?
No, Chair.
No, good. Right, okay, we'll go straight then into item number 5, which is the local COVID-19 situation. And is David Monday going to lead us off on this?
I am, Chair.
I'll hand over to you. Thank you, David.
Thank you. So for those who don't know me, my name's David Monday. I'm the public health consultant for Reading. So this agenda item is just to talk through the current COVID situation. So apologies in advance that there's a reasonable amount of data on the slides. So, but I'll try not to just turn it into an epidemiology lecture. And of course, happy to take any kind of questions or comments at the end. So the first table that we've provided just shows you the the kind of headline metrics that we've been using kind of throughout the pandemic to monitor where we're at. And probably the most important of those is the column which is in red, which is our case rate per 100,000 of population here in Reading. So you can see on the slide that I appreciate it's slightly small font, but it's 165 per 100,000. So those are in a rolling 7-day period, that's the rate of people that are testing positive for COVID-19. As you can see, the arrow indicates that that's increasing as it is across Berkshire, and indeed it is regionally and nationally. And then just to the left of that, you can see the what we call the positivity rate. So that's of everyone going forward for a test, the proportion who test positive. And at Reading at the moment in the last week, that was at 3.5%. You'll note that we've got our testing rate as well. So that's the first column on the left, which is in white. And then we've also got our rate for over 60s, and I'll come back to age in just a moment. So overall in Reading, we are higher than the other Berkshire areas currently. And as I'm sure people are aware, throughout the pandemic, it's varied a bit as to where Reading sat in terms of Berkshire comparison, and also where it sat within the southeast and nationally. And these things have variated as we've gone through. We're slightly above the England average currently, and I think probably the reason for that, and the reason that we're higher when you look at the Berkshires, is that we did seem to get cases of the Delta variant in Reading earlier than in other places, and we know that the Delta variant spreads more readily than other variants of COVID, and our rates have therefore kind of accelerated a little bit quicker than elsewhere. Obviously, us being an entirely urban borough contributes as well to kind of ease of transmission, and maybe also the profile of our population. So Nikki, if you're able just to move on to the next slide, I'll just come on to that age profile a little bit more. So don't worry about, and these numbers are probably too small to read, but what you really need to pick up on this table is the colouring, not the numbers. So what we've done here is plotted for a 4-week period the case rate, so that same number of people testing positive per 100,000 in a rolling 7 days, so the same as what I was just referring to. We've plotted that at the very top of this table for all ages, so you can see where we're at currently in that 165, because the data just to the right of the dotted line is too early to be confirmed. So that's our overall rate. But then you can see the rate for each of those age bands, and where rates are higher or lower. So clearly what stands out from this, as well as a gradual increase that we've been seeing across Reading, is that our 19 to 24-year-olds have the highest case rates, and that's where numbers have been increasing more than anywhere else. The other thing that stands out to me on this table is that, and the reason I've put the arrows in for you, is that in earlier waves of the pandemic, what we've typically seen is higher case rates in the younger adult population, followed by those rates then rising in middle age and older age adults, and you kind of get that diagonal effect where, as you move through a 4-week table, you see the darker shading kind of moving up the age bands. We're not seeing that at all now. And the reason that we're not seeing that is because the vaccination program is rolled out well and is effective at managing COVID locally and stopping that spread up. Whereas those in the 19 to 24-year-old age band are either currently unvaccinated or have not been vaccinated for more than 3 weeks with dose 1. And won't have any significant levels of immunity yet. And that, so that kind of unvaccinated or just very early vaccinated phenomenon is primarily what is therefore kind of driving the numbers that we can see there, as all of us, as a town, we're unlocking and all of us are able to be out of the house more, able to socialise more and do more of the things that we want to do. That's the population that are doing so, but without the benefit of vaccination. So that's primarily the driver for I think the difference that we're seeing in the age bands here. It's also fair to say that across the town, 19 to 24-year-olds are more likely to be employed in the service sector, which obviously itself is a sector that's now opening up, greater risk of exposure and transmission at work as a result of that. We've also obviously have a large university in the town as well, and although outside of term time now, there are still many students around, and they have seen some increased case numbers within halls and within the shared student houses in the university area. We've looked through the data kind of line by line because we can see the data on every individual that tests positive in the town, and it isn't the case that the increase we've seen is because of university students. It's, as I say, there's far kind of more to it than simply that. So the next slide, please, Nikki. I'll just be brief on the next two. So this is just going back to that comparison between Reading and other Berkshire areas. And you can see, I've said that the experience in different areas has been different throughout the pandemic. You can see that West Berkshire had a lower spike in over the winter period, and Slough had a much higher one. And as we've already seen, currently Reading has the sharpest of the uptick at the kind of present time. And then on the next slide, it's similar data, but just showing you on a map. So on the left is again just comparing case rates across Berkshire and the Reading area. If you're not familiar with the map, is the darker outlined area. And then on the right, what's actually interesting is that the right is then showing the percentage change of the rate, and you can see that actually Reading's doesn't seem to be climbing in the same way that maybe it is in other areas. So and that's where I said earlier that that clearly different areas just seem to get different kind of intensities of the pandemic at slightly different time points. So next slide, please, Nikki. We've clearly heard a lot about variants of concern recently, and we've heard a lot about the Delta variant. And we know now that it does transmit from person to person more easily. But we also know that the vaccine is very effective at preventing people becoming seriously unwell, preventing hospitalization, and it does also have impact in terms of reducing transmission. This graph is trying to show you a bit of a trend over time, starting with early December, so at the beginning of the winter wave that we saw up to present day, and really a time period where we've seen 3 different variants. And one of the ways that we monitor for variants in Reading, like we do everywhere, is that we look for the specific genes that are present or not present within the PCR, the lab test samples that are taken. And the first variant that was responsible for wave 1 in the UK had this S gene. So the genes are just labeled with different letters of the alphabet, had this S gene that was present. And then we saw that as what we were at the time calling the Kent variant, I think we now refer to as the alpha variant, as that started to increase, and that over the winter, we saw that S gene was not present within the lab samples. So we had this S gene target failure, as it's called, so SGTF. And you can see that over the winter, the presence of S gene target failure took over to be all of the cases that we were seeing locally. And then what's happened with the Delta variant, as the virus has mutated, it does have the S gene. So you can see that now where we are currently, that we again have a very rapid turnover to all of our cases, or virtually all of our cases, having the S gene present, which when we do the lab analysis is a very quick indicator that we're dealing with the Delta variant. And then what happens is we then do the full genetic sequencing so that we can kind of see that absolutely, and we can be certain that it's the Delta variant that we're dealing with, not simply a different variant that might happen to have the S gene. So it's a way of rapidly seeing what's happening in terms of the spread of variants. So next slide, please, Nikki. So other thing then, just to kind of show this is just very recent data, so just for May and into the first part of June, just to show you, and there's 2 bits of information on the graph here. So the blue bars relate to the numbers on the left and is simply the count of the number of confirmed Delta variant cases in Reading, and you can see how quickly that has increased. And then on the right, you can see percentages on the scale, and those relate to the orange line, and that's just the proportion of cases in Reading that are due to the Delta variant. And you can see that now we are basically at 100% of the cases in Reading are the Delta variant, as it essentially is across the country. Okay, if you move on to the next one, please, Nikki. So members of the board will be familiar, I'm sure, with this graph, which I show each time, which is the monitoring of death in Reading. So something clearly a very sobering feature of the pandemic, but one we have to follow very closely. And the blue within this graph are deaths where COVID-19 is the cause on the death certificate, and orange is where it was any other cause. And then the grey wiggly line is what's average in terms of the deaths per 100,000 of population for that time of year, because that does change naturally, if you like, throughout the year. And really what stands out currently is that you may just be able to see one line of blue in the most recent week that we have data for, so week for the 11th of June, showing we did have one COVID death then, prior to that none really since Easter, and we sit just below what's average for the time of year. So that's positive news. Clearly we don't want to see any COVID death, and we're going to continue to monitor this closely. My expectation is that over the course of the summer, and with the strength of the vaccination program, we'll be in a steady state with this, and I wouldn't anticipate that would dramatically change. But as we move into the winter, it may be more challenging again, not simply because of COVID, but because seasonally we know that we see more death at that time of year. So this is, as I say, one to be monitoring closely. And then move on to the next slide, please, Nikki. These 2 are then just to show you what we're doing to support self-isolation in Reading. And again, I regularly show these at this board. So there's quite a lot on this slide, but the key thing to show you are just the squares and rectangles at the top. So if you look at the red in the middle, you can see that nationally test and trace reaches almost 77% of cases in Reading to give the advice to isolate, or the requirement to isolate, should I say, and also to do the contact tracing. The remaining 23% get passed to our local council run service, and those are the cases that are in the purple of the squares on to the right of the slide. And of that 23%, we managed to reach just over 60% of them to, again, ensure that they have that advice and requirement to isolate and to do the contact tracing, which overall means, and shown in the black squares, that we get almost a 90% completion rate locally, which is very good. And then on the next slide, what this simply shows, again, there's quite a lot of data on the next one, but it's just to show you that we have an initiative where whether someone is reached by the national test and trace or whether they're reached by the local, either way, they also get a call to offer support for isolation, to help them isolate, knowing that for some people it can be quite difficult to isolate, whether that's because of financial hardship, whether that's because of food shopping. There can be a range of reasons. So this is just to kind of demonstrate the volume of calls that are made and the support that is offered, as well as obviously the reminder of the requirement to do that 10-day isolation. So the last couple of things from me then, if we go on to the next slide, please, Nikki. Of course, wanted to touch on vaccination, the vaccination program. So the bars along the top of this graph are showing us the proportion of people in Reading who have had at least one dose of the COVID vaccination. And of course, what you see to start, the first thing that catches the eye on this is that vaccination coverage is determined by age. And there's primarily 2 reasons for that. One of those reasons is that we're still rolling out the programme. So, you know, those under 25 have not all yet had the opportunity to come forward for vaccination. They're able to do so now, but, you know, only for over the last couple of weeks or so. So as the programme rolls out through the age bands, of course, you get that difference as you're still doing the work. And also, there's probably a difference in how susceptible people feel they are to COVID, and therefore maybe something on the motivation to come forward for vaccination as well. And then the different colours within each of the age band just give you a feel for how Reading compares, which is the light blue, to the England average, which is orange, and then in the darker blue, the comparison to the local authority areas in the country that are most similar demographically and economically to Reading. And you can see that we are just slightly under the average to those comparable areas. And later on in the board meeting, we've got a presentation about surge testing and surge vaccination. So clearly one of the things we've been doing about that is the surge vaccination clinic that's running currently at the civic offices, and colleagues will talk about that. And there's also other initiatives that are happening as well. And I think Katie Summers is with us today, who's the director from the NHS, who's responsible for the vaccination programme. She may well just want to update that item just about some of the other initiatives. The vaccination bus. We're also doing some door knocking of people that haven't responded to the vaccination offer, to see if they need support to, for transport to clinics and all those kind of things. So so plenty more that can be said of vaccination. We'll probably come back to some of that. And then on the bottom left of the slide, it's just showing you over time how that coverage has increased in Reading, but then also in the national and the near neighbour comparator. And then the final thing from me on vaccination then is just on the next slide. It shows you a map of Reading, and apologies that on the map, I noted earlier it hasn't got the scale on it. But Nikki, if you're able to move on to the next one, if the IT allows, just to give you a sense of how vaccination uptake varies a little bit across the town. And what we see in Reading, as I show on this slide, the difference in age, we also see a difference in the geography as well. So if it looks like Nikki's fighting with the machine, so if it does move on, you'll see a map. It feels like you almost like a drum roll now. It's got a bit of a build up. But what we see is a difference of approximately 15% or so in uptake between different parts of town, and some of the additional work we're therefore doing to boost vaccination uptake is targeted at those kind of specific bits of town where uptake's a bit lower. Well done, Nikki. You've beaten the slides into submission. So the darker the shading, the higher uptake is. The lower the shading, the lower uptake is. And one of the other reasons for that variation is that clearly those under 18 are not being offered vaccination at this stage, and we know that the demographics around Reading are not uniform, and in fact we have a younger population in certain parts of town. So the map is not simply showing you kind of vaccination hesitancy, but it's showing you also some of the difference just in our demographics in Reading, which inevitably then pulls into what's happening in terms of vaccination coverage. And probably in Reading, we think we've got a greater because of how mobile our population is and people that move in and out of the area, some of the route data that we use to measure vaccine uptake doesn't always immediately reflect people's geographical move, and therefore some of the people that would be considered unvaccinated in Reading are actually people that did live in Reading a few years ago but don't live here now. So we're doing some of the work to tidy up that data as well. So the very last slide from me, Nikki, if the computer is now behaving itself, is just to say I think we all know about the kind of release from lockdown plan and the roadmap. So clearly, at the point of this being produced, the hope was the step forward would be from the 21st of June. Clearly, we know that's been delayed now, and we're awaiting the confirmed announcement about that happening on the 19th of July. So it was really just to note that I think there remains some detail that we're looking to see in terms of exactly what remains in place from the 19th of July and what is lifted. So I think that's everything from me, but Chair, happy to take any questions or comments if helpful.
Great, thank you, David, for that that run through. I think it's really useful, very interesting, and helpful to get an understanding of the age profile of cases. I think that's really important. I have got a question, but I will come back to my questions. I've got I'll call you Councillor Simon Robinson. Simon, to ask a question. You're indicated by hand, Simon, I guess.
Yeah, certainly. Thank you, Councillor Hoskins. Yeah, my question is, obviously, recently we've been informed of a new variant that has entered the UK, being the Lambda variant. I think on the 29th of June, there were 6 cases identified. Is this something that is creeping on the radar in our particular region, or have we not detected any of this new variant yet within Berkshire, if I can ask that?
Yeah, thank you. Important question. At this point, no, we've not detected any of that within Berkshire, and that kind of monitoring, which is led by Public Health England, continues. And variants, I was going to say variants vary. That's clearly a statement of the obvious, isn't it? What I wanted to say was that variants are different in the degree to which they pose a public health problem or not, because we know that viruses will mutate and change all of the time. Sometimes viruses mutate and those variants occur, and they seem to be less transmissible or less impactful. That may not be the case with the Lambda one. I guess we'll wait to see. So the presence of one doesn't always equate to it then becoming virulent and spreading. But at this point, we're not seeing it within Berkshire.
Thank you for that. Okay.
Thank you, Simon. Anybody else? I've got, well, I think there's one thing I think it's worth pointing out when you talk about vaccinations, and I'd like, and the Local Engagement Board would like to join me, I'm sure you would, in thanking the Watling House Vaccine Hub, which is closing on Saturday. I'm told it's been 6 months of delivery, 31,000 vaccinations. So, I'd like to thank all concerned for, really good job done. Health staff, the RVA have worked really hard, and obviously the volunteers that have been involved, have really made that happen. And of course, the Watlington House trustees as well for supporting that. And I think I'm right, David. So in terms of the provision in that area, there's local pharmacy vaccinations, and obviously the main hub itself. Is that right, David?
Yeah, that's right. So what that hub has delivered really successfully is vaccination to what we've called cohorts 1 to 9 as we've rolled out the vaccine programme. So which is essentially anyone aged 50 and over, those who have long-term conditions that put them at greater risk of COVID, carers, etc. And they've now kind of been able to make that offer to everyone registered with the Central and also the South Reading PCNs for both dose 1 and dose 2, and hence that will now close. But for those that would be that are registered there who are under the age of 50, the offer is through the mass vaccination site, so on the national booking system. So to the Medeski Stadium, there's also the Early Road Pharmacy, which is conveniently located for that, for a lot of the central kind of part of town. It's actually not far from Watlington House itself. Obviously, the surge clinic that we currently run at Civic as well. So for those practice populations that are then under 50, then yes, it's primarily through the national system to get vaccination, and there's plenty of capacity to be able to do that for those who are yet to have come forward.
Okay, great. Thank you, David. And again, thanks for the magnificent effort at Watlington House. Actually, my question is going to come in the next presentation. So unless anyone else has got any points they wish to raise, I will just simply say thank you very much for the presentation. I suppose the one thing we need to come back to, David, I think the work around actually door knocking on people who haven't responded to the the vaccination offer is really important in terms of driving up rates. Obviously, that's just beginning. So one of the things I'd be really interested in is how that succeeds. What kind of information is coming back, and what they find, I think, be really important to us.
Yeah, more than happy to bring that back to a future meeting when we've got kind of some of the clearer kind of outcomes from that available.
Okay, I've got Simon Robinson again indicating.
Yes, sorry, I should have asked this before. The Janssen jab, obviously the one-shot vaccine. A lot of people obviously will be looking to potentially go on a holiday soon, and obviously currently you need 2 jabs, but obviously with Janssen that's going to be a one shot, and then people can, you know, depart for foreign shores if they haven't had their jabs so far. Do we know what timelines or when the Janssen jab is likely to become available within our particular area?
I don't know that. I think it's a good question. Although I think with any vaccine, and yes, you're absolutely right. Of course, it's a one dose for the Janssen. The potential for needing boosters doses either because of waning immunity or because of variants that we need to have a specific booster for would remain. So for the kind of medium term, I don't, you know, it may well be that anyone having Janssen would need a subsequent one. But Katie Summers is indicating so sorry, Chair, but she may just have a little bit more insight on the specifics of if and when we'll see Janssen locally.
Hello, thank you very much for inviting me, Councillor Hosking. So just to introduce myself, I'm Katie Summers. I'm the Director for Vaccinations in Berkshire West. So thank you very much for inviting me to this meeting. On the actual piece of the Janssen, where we are just waiting for, obviously it's got to go through the approval process through the JVCI as such. So once that does come available, obviously that will be actually available as such going forward. It will all very much dependent on the supply though. Giving some early indications, I expect that will probably come out possibly later in the summer, maybe early autumn as such. So we're just all waiting really for this. What I can do, Councillor Hoskin, is actually just give a bit of a flavour about the early door knocking information. I'll invite Ailish to do that when we get into the surge and the testing site information, because I think actually people would like to know some of that, if that's okay.
Yeah, that'd be great. Thank you.
Yeah, thank you.
Okay, thank you, Katie. Right, okay, thanks very much. I haven't got anyone else indicating, so thank you very much for that, David. And we'll move on to the next item, which is a communications update. Do we have?
Chair, we are going to, if it's okay, the communications part will merge in with the surge vaccination.
Sorry, yeah,
and surge.
Yeah, it's clear says that in black and white. Sorry, that's very right. Outbreaks, lessons learned. Katie Heath. Hello.
Hi, good afternoon. Thank you for having me. My name's Katie Heath. I'm the Principal Environmental Health Officer in the Food and Safety team. I've actually been asked to speak with you more about the work we've been doing since the relaxing of restrictions on the 8th of March as opposed to Outbreak. So I apologise if my presentation is going to not meet expectation. If I could have the next slide, please, Nikki. So just to give an overview on the work that we have been doing since the 8th of March across regulatory services, which comprises the food and safety team, licensing, public sector housing, trading standards, and environmental protection. So across several of our teams, we've been prioritising COVID work amongst our existing workloads and dealing with complaints that are coming from a number of sources, including direct from the members of the public, referral from businesses, and notifications of positive cases which come through from Public Health England and the Health Protection team at Thames Valley. In addition to this, we're also conducting proactive work, undertaking inspections, interventions, and providing advice to businesses where we can. I'm sure you're all familiar, but initially we had a high-risk settings team set up to focus on the COVID-related work, and this has continued for much of the time since December, as we've progressed through the pandemic and staff have had to be taken back into doing other work. This work has sat with environmental health and licensing. So where possible, we've tried to align our work and focus with the lifting of restrictions and focusing on premises of high interest. And you'll recall the predominance of supermarkets in the media in January 21 to prioritise this work. Following on from that, environmental health and licensing staff have continued to undertake proactive visits to high priority premises. We've had a physical presence in the town centre at each restriction change, so as to undertake visits and be a point of advice within the town in order to kind of assist with any information that's required. We've been working with local industries to support them throughout the pandemic, including our existing pub watch group and local partnerships, and have continued to provide written business advice tailored to that sector. Some of you may have seen, but we've had a couple of local media slots where some of our colleagues have presented on local news channels, undertaking inspections and hopefully demonstrating some of the good compliant businesses we have within Reading. We've continued with partnership working, particularly with the Health and Safety Executive, who are undertaking some visits and spot checks and telephone calls in relation to assess COVID compliance. We've worked with BID, and then we've also carried out tailored joint visits with Thames Valley Police. Throughout all of this as well, we have maintained a 7-day-a-week duty rota, which we monitor 9 till 5 weekdays and weekends. If I could have the next slide, please, Nikki. So in addition to this as well, we've been focusing on events. There's a large number of events that have come in to the council, either requiring a license or attending our safety advisory group meetings, and through those channels we have been advising them and liaising with them about COVID restrictions and what may or may not be appropriate. It's a challenge for all concerned here, as we've been uncertain as to exactly when restrictions will be lifting. It does cause some questions as to whether the event will be able to go ahead should there be any social distancing restrictions remaining in place. We've also focused works in relation to Reading Football Club. So we have a close working relationship with the staff there anyway. However, we have put in place additional safety advisory group meetings and incorporated public health colleagues in this to liaise with them about their measures in place so that we can ensure the safe return of spectators. We've been working with them to review their procedures, provided additional advice, undertaken match inspections, and amended the capacity of their safety certificate to reflect permitted numbers. If I could have the next slide, please. Moving on, I just thought I'd explain a little about what action we can take in relation to the premises and the businesses that we're dealing with. So initially, when we get notified either of a complaint or a notification of positive cases that come through from the health protection team, we triage these as best as possible. So we take into consideration the action that the health protection team has carried out, who themselves risk rate the positive notifications that they receive, and consider their setting, the number of cases, the frequency of those positive cases arising. They then provide a reduced list of potential premises of concern through to us. They are undertaking some initial work in relation to assess whether the business is COVID secure and how those cases may have manifested, and are then passing those on to us to follow up at our discretion, where we can also apply local knowledge of the businesses. We take into account the previous interventions that we've carried out, including proactive visits, any advice given, and any of the focus work we've done throughout the pandemic through the HRS team. We also take into account the complaints that we've received, whether the positive cases are amongst employees or customers, and then the number of cases in an epi curve, and considering, you know, when those cases have arisen, where the frequency is, and what the time gap is between those. Essentially, with each business, we're trying to ascertain the level of COVID security there. So we engage with them and look to consider, you know, whether they have a COVID risk assessment in place, whether they're complying with the government guidance which is in place at the time, have they carried out their contact tracing, are they isolating any cases or any close contacts, what arrangements do they have for working bubbles, and how do they fit amongst the working patterns of the staff and the number of staff that are in place across the business. Where possible, we're trying to use our local knowledge of our businesses to focus our works on the small, medium enterprises and those that are independent, local, and have less resource available to them. And then where possible, we are also trying to encourage the uptake of vaccination and the uptake of LFD testing amongst staff. If I could have the next slide, please, Nikki. So I just wanted to give you an example of a couple of premises that we've dealt with, and how we approach our work with those. So the first premises, a national chain, hospitality, so obviously seeing a lot more proliferation of customers there at the moment. They have a primary authority partnership with a local authority, so they have access to extensive business advice tailored to them available. So on this particular occasion, we received a notification of several positive cases amongst customers, which occurred across several days. And there was also a lag in the notification time. So when this was received by RBC, the cases had been kind of 2 weeks to 10 days prior to us receiving that information. So what did we do? We spoke with the health protection team who notified us of the positive cases, and to ascertain what information they'd already gathered and what action they'd taken. So they had contacted the business themselves and discussed contact tracing, isolation, and cleaning with them. They didn't have any follow-up concerns from this. We reviewed the previous interventions that we'd carried out at RBC. So from that, we gained that our previous liaison with them had determined that they were compliant and that there were no ongoing concerns at the time. By the time we'd received the notification, the isolation periods for all cases had passed. We then carried out a remote intervention with them and contacted the premises directly to verify that they had COVID secure practices in place, that they had obviously properly isolated their staff, that they had undertaken a deep clean, and that they had an appropriate COVID risk assessment in place. And on this particular occasion, we deemed that there was no further action necessary for this premises. If I could have the next slide, please, Nikki. A second example of a premises intervention. So this one was a local independent community centre. We received a notification late in the afternoon that the premises was named and of concern to the health protection team. It was the only existing link between several cases of COVID-19 within the area. And the health protection team had concerns about sorry, I'm losing track without the slides, I'm afraid. The health protection team had concerns that the business wasn't undertaking appropriate contact tracing. So from that, on that initial afternoon, we contacted the business straight away to speak with them, try and ascertain what measures they had in place and whether they were COVID secure. It's just the one above Nikki, titled Premises 2. Thank you. So from our initial conversation with them, we did have further concerns as to whether they were undertaking their contact tracing properly, as that was indicated that they weren't able to provide the necessary information for all cases that had been, or all, sorry, not all cases, all attendees that had been to the premises. We did, however, still request that information to be provided over to us, so that we could provide that to the health protection team to identify further cases. Following that, we undertook a COVID secure inspection the very next working day. Whilst when we were on site, a lot of our concerns in relation to contact tracing were allayed, and they did have suitable information in order to provide the detail of customers so that we could provide that to the health protection team. We did identify some further improvements and provided them business advice and work with them to put those in place and action those immediately. We followed that up with further correspondence. However, following that and at present, from the correspondence we've had, they have actioned everything we asked them to do, and we haven't had to have any further involvement with them at the moment. So following that, we then obviously updated the health protection team. Could I have the next slide, please, Nikki? So just to summarise in terms of what we can do and what we do. So where we've got compliant premises, we haven't been focusing kind of further work on these at the moment. We have, however, continue to monitor all of the complaints that come in, and where any complaints or notifications of positive cases indicate that there are a problem, we do still continue to follow these up with the premises, even where they have been compliant previously. In terms of non-compliant premises, so we have a range of options available to us for the majority of premises, although these don't all apply to premises classed as essential infrastructure. But we have a range available to carry out COVID inspections, provide advice, undertake revisits, provide formal written warnings, and issue notices. And if I could just briefly run through some of the numbers of work that we've done since the 8th of March. So since the 8th of March, across environmental health, we've received a further 81 complaints about non-compliant businesses in Reading. Between environmental health, the HRS team, and licensing, we've carried out 104 COVID inspections. We've provided business advice on 86 occasions. We have conducted a further 23 revisits. And then in terms of notices which have been issued by environmental health, we've issued 4 coronavirus improvement notices. 2 of these are for failure to display a QR code, 1 for not obtaining or recording contact details, and 1 for not displaying signage to encourage the wearing of face coverings. And then we've served a improvement notice under the Health and Safety at Work Act due to the absence of a risk assessment in relation to COVID-19. If I could have the next slide, please, Nikki. And then just briefly to explain some of the challenges that we're facing in relation to this work. So as David alluded to in his presentation, obviously a lot of the sectors are opening up, and in general we're allowed to do more things and there's more socialising permitted. So as this has gone on, people are able to visit more premises, and that creates more triggers. If there are then cases, that's more cases, more cases for the health protection team to review. And when prior to the restrictions lifting, they were kind of identifying maybe 0 to 5 notifications of a premises where a positive case may have been, and now this is in excess of 80 to review per day. There still remains a lag time for cases coming in where there's a positive result reported, which obviously impacts both the health protection teams and our ability to get to those promptly. I think it's also important to note that the public and individual expectation and general portrayal of compliance has changed over this time as well. I think it's has become more accepted that people are out and about, and and we see people doing more things. It has been a challenge to advise businesses on restrictions at times ahead of those changes. We're frequently asked, what's going to happen next, and we don't have that information prior to that being released by the government, either through the announcements, the legislation, or the follow-up guidance. We're still continuing to receive anonymous complaints. Some of those can be quite difficult to follow up if we're not able to gain certain or specific information about the premises or the nature of the complaint, or if indeed we don't actually know the premises itself. We do have limited resourcing, and we're also trying to maintain and build back up the other work that we do, including addressing the backlogs that we of work that we have from the initial restrictions that were put in place last year. There's cultural challenges. We have some businesses that we deal with regularly that are non-compliant across all of our work areas, and they can be quite challenging to deal with, and that challenge remains in relation to COVID-19, and where we have businesses that are not necessarily as willing to comply, that does become quite resource intensive. I think it's also worth noting that historically, health and safety has had a relatively low profile, and for quite some time there's not been a requirement nationally to undertake proactive health and safety inspections, and therefore for some businesses we're speaking to them about risk assessments, and it's a word or a phrase that they've not heard before, so we have to kind of overcome that barrier as well. And then we've also had issues ourselves where staff have had to self-isolate after having notifications of contacts after carrying out inspections. That is the end of my presentation. Thank you very much for having me, and I'll do my best to answer any questions that you have.
Great, thank you, Katie, for that. I do have a question from Katie Summers. Were you wanting to ask that yourself, or would you like me to?
I don't know what the policy or the etiquette is. Councillor Hosking.
Ask your question or any question you like, really, Katie.
Okay, so Katie, thank you very much for a very, very detailed presentation. It's just a question on I don't know whether you heard it in the on the radio and in the news. I think there's growing tension at the moment about what's going to happen on Saturday, with a lot of the sites opening themselves up for viewing football. So is any form of guidance that's being given out at all to premises who are going to be actively looking at viewing the football, because that's going to be challenging? I appreciate lots of these sites are going to be open in the open as such, but just wondering.
So we have been working with a lot of our premises that show the football, which are predominantly licensed premises. So we've been working with them through the Pub Watch group that that our licensing, environmental health and trading standards teams all sit on and contribute to. So we have a direct route through them and have provided them advice throughout the pandemic. Our licensing team have also contacted all of the licensed premises in Reading, particularly those that are more likely to show the football, with joint communications between ourselves and Thames Valley Police to address the matters of the football, which have I believe there's been kind of previous issues at other major football tournaments within Reading, and we've kind of addressed those through that, whilst also focusing attention to the fact that we are still in a pandemic. We do have our licensing team on shift. They work across the weekends and are visiting premises which to them are considered to be, I guess, maybe the more higher risk premises in relation to these matters, and they are undertaking visits both weekdays and weekends, and particularly on football match days with the England ones. I don't particularly follow the football myself, so I'm not quite sure which days, but we have had those persons out in town, and we are jointly working with Thames Valley Police as well.
Thank you, Katie. That was very helpful. You'll see a little image that I've put on the screen here, and I must admit the comms teams are trying to get out these messages. I think it's actually a very powerful image as such. Make sure football's coming home, not COVID-19. So again, it'd be really good if we could get some forms of messages to be put into those premises with that sort of image. It's quite a powerful one really going forward.
I mean, I can definitely take that image and forward that on to our licensing team manager, and we'll take that away from this meeting, hopefully, as if England do progress through the championship, then hopefully they can have some further interventions with the premises.
Thank you.
Great, thank you, Katie. I guess fair to say in Reading we don't often have supporters hugging themselves in celebration very much. It's the England team's provided some of that. So obviously challenge. No, that's really helpful. I don't. Nobody else is indicating that I can see. So sorry. I hope I missed anyone. I'm not sure you can answer this question. You talk obviously about the changes that are coming July the 19th, and I suppose my question is thoughts around the role of the team when it appears that we're going to be moving away from sort of formal legal restrictions towards recommendations and guidance, which obviously poses a considerable challenge, I would imagine, for teams like yourselves and what you're doing. So I suppose it's if you had any thoughts about how that, but clearly your teams have those links into the kind of businesses that we still want to be influencing around COVID safety. So I wonder if you've got any thoughts around that sort of switch in role.
I mean, obviously at this moment we're not, whilst we're hopeful, I guess in some respects that the restrictions or that the government follow their kind of intended timescale for those, and we don't have the specific information about exactly what restrictions may or may not remain in place on the 19th of July. We have altered what we're doing at each step of the restrictions or the restrictions easing to work with the businesses, and we'll continue to do that. So we do stand ready across across regulatory services to liaise and engage and intervene with the businesses with the resources that we do have available.
Okay, thank you. As Tomlik says, clearly, July 19th may be delayed as cases rise, although all the indications are otherwise. I suppose my thought is, and so I'll leave it at that, is that the guidance from government may appear to be wholly inadequate for the situation we're facing ourselves locally, and I guess we'll just need to respond to how we support Reading people and Reading businesses to be as safe as possible. And as Tom says, with cases rising, but I'll leave it with that. It's going to be a challenging time, I suspect, but thank you very much, Katie, and thank you for that explanation of the work you've been doing, which I know about and has been really important over the past number of months, and it's really appreciated, because I know, talking to your teams before the pandemic, you were stretched and working hard and struggling to meet all your requirements. So the pandemic on top of that, I can imagine, has been a massive challenge, but really pleased about how hard everyone's been working.
Thank you very much. Thank you.
Okay, thanks. Right, so we'll move on then to the surge testing. So it's vaccinations, in which we're also rolling in the communications into that. Who's going to lead on? Oh, we've got Mike Graham. Right, I'll hand over.
Hi, Chair. I'm here. I think Nikki's here as well, hopefully.
Yep, here too.
Yeah, thanks. Well, I'll kick off. I'm Mike Graham. I'm the Assistant Director for Legal and Democratic Services, and members of the Outbreak Engagement Board will say, what's he doing involved in things like surge testing and surge vaccinations? That's clearly not his field, and that's a very astute observation. And I'm clearly not as good as keeping my head down in meetings as I should be. That's all I will say. So I'd like to talk to you this afternoon about what we've done recently in relation to surge testing and surge vaccinations. Those are the commonly understood terms for what we've been doing, though you'll see in some of the communications that we've adopted slightly different terminology as we've gone along. So the background to this, we're going back now to just before the end of May bank holiday. That's the timing. And we were looking at the numbers then about the cases of the Delta variant, which were rising. And you'll see on that slide that there were about 68, and the next slide shows you where they come from, but we'll just stay on this slide for a second. And we could also see that there were rising rates in the younger population, and David's slide previously has given you some further information which shows just how a few weeks afterwards that data has come in and what that looks like. And we also knew that there were higher rates in some of the ethnic minority groups in towns as well. We also knew that these were non-travel cases, and we were seeing them in 4 particular postcode sectors of Reading. So we decided that there was a case for additional testing to help us understand where the Delta variant was spreading in Reading. And this wasn't something which was done in isolation, because similar case numbers were evident in Wokingham as well. And therefore this became a joint project with Wokingham and with our NHS colleagues, of course, focused through public health. So I'll take the next slide now, Nikki, please. So this is quite a difficult slide to read in the terms of the small font size, etc. I'm just going to bring my own version up on my own screen so I can be clear what we're looking at. So you'll see on the right hand side of that slide then the increasing numbers of what we call Manchester City blue, kind of the bars on the graph there. Those are the rising numbers of the Delta variant over that period. That's what we're looking at, going from the beginning to the end of May, which is the period when we started to consider implementing this additional testing for the Delta variant. So the next slide, please, Nikki. So tracking through where we were seeing those cases, we were looking at 4 sectors in RG1 in particular, which actually had about 30,000 people in scope. So we were then focused our additional testing, as we called it, in public. But in sort of tabloid terms, it is always referred to as surge testing. And we avoided surge testing just because it sort of evokes an image that the whole of the borough is going to come out and everybody's involved, whereas in actual fact, our testing strategy was more targeted and focused, and I'll come on to explain a little bit more about that. And so we badged it as additional testing, which I think is more accurate to what it was. So we were looking at then giving this additional testing to anyone over 12 years of age, living, working or studying in these parts of RG1. And the additional testing had a discrete time limited period to it, 7th to the 20th of June. So on the next slide, what you'll be able to see makes a little bit more sense where those postcode districts are if you're not familiar with them locally. We're sort of looking at these areas east and west of the town centre. Next slide, please. Now the sites, again, this is a list of where you could get tested. The basic offer for residents was that they could themselves go to any number of test sites which were between Reading and Wokingham. And of course, it very much depends on your own travel routine in the day. We had one in the town centre at the town hall. We utilised our existing Prospect Park site and turned that over from symptomatic testing to being symptomatic testing for part of the day and then asymptomatic testing in the afternoon. That was a walk-in site at Prospect Park. Similarly at Reading University, where there was already a local testing site, so that became asymptomatic testing in the afternoon as well. And then a further mobile testing units were situated at Reading University, Thames Valley Park and Ride, which is just over the way in Wokingham. And then there were a number of other sites in Wokingham which Reading residents could access if they were travelling out that way, but we didn't think would be particularly helpful for them. But those were the main sites which we had for Reading residents, and as well as an area which was in Reading University car park, And initially that was an offer for the first weekend for students only in halls, and then that became something which was available to everybody who was close by. So there were a number of places where residents could go to, but of course we were targeting not just residents, we're also targeting businesses and schools. So I'll come on to a bit on that. Can I have the next slide, please? And so our testing strategy then for residents was wide communications via the methods which Nikki's going to come on and tell you about in those 4 postcode sectors, trying to get them out to go to those testing sites. We also knew that we wanted to work with partners who could be able to get out those harder to reach groups. And so we targeted some of those community groups to be able to help us spread the word, sort of more narrowcasting rather than broadcasting. So that was the approach to residents. In relation to businesses, we had a much more targeted approach. We knew we were looking at those smaller businesses, east and west of the town centre, in those different parades, but also scattered throughout the community. And we also knew those kind of small businesses were probably unlikely to be able to send themselves or their staff out to those testing centres in the middle of the business day. And so what we did was we said, well, they're not going to come to us, we'll have to go to them. So we had a targeted approach for those where we sent teams out to go and knock on the door of those business premises, and we then delivered kits. So we went one day, delivered the kit, gave them a bit of time, like 24 hours. Then we came back and collected the kit, and then the kit went off to the courier and it was then sent for normal genomic sequencing. So that was a good strategy. It involved a small number of council staff who were redirected from their normal duties. There were volunteers, people who could fit it in to their normal working pattern. And we had a team of about 18 of those who were working with the COVID-19 Emergency Operations Centre, who did a splendid job in actually making sure that this whole operation was logistically planned and delivered to go and see all those businesses. They also then ran the operation for schools. So in relation to schools in those areas, we were targeting the primary schools, but not the pupils, because of course, remember, we were looking at 12 years and over. So we're really targeting the staff there, treating it as a business. So we took the kits directly to the schools and then collected them. And then in relation to the secondary schools, we were, of course, looking at the staff and the pupils, and we went and delivered and collected the kits there as well. So that was part of our targeted testing strategy. And of course, one massive business that we've got in that area is the hospital. And we also had a large delivery of kits directly to the hospital, and we collected them from there as well. And as you would expect, there was a very high compliance rate amongst all the staff at the hospital who understood the value in what this exercise was about. So we had a tremendous return rate from the hospital, tremendous return rate as well from the schools. I'm going to come on to that in a minute. We had a bit of a lower rate with the businesses. I won't embarrass the particular large business in the area, but there was a bit of a miscommunication. So a large batch of samples weren't available to be collected. They had in fact posted them back, and so we lost those out of the system. So it was a bit of a disappointment and led to a lower return rate there. But otherwise, we had a very good return rate. So we'll come on to that in a minute. Next slide, please, Nikki. So hand over to Nikki Barton here, my colleague, who's going to talk a bit about then the communications approach to how we did this campaign, and then I'll come back and we'll talk about the numbers of responses that we got.
Thanks, Mike. So as Mike says, my name's Nikki Barton. I manage the communications team at the council. Usually we have a separate comms section on the OEB, but because the majority of the communications we've done in at least the last 8 weeks have been around vaccination and testing, we thought it was better to kind of wrap it up together. But just a reminder, we have as part of the outbreak engagement plan, we have a comms strategy, and these are the 3 key planks of that strategy: that we amplify national messages. So the most obvious example is whatever the lockdown rules are at the time. Then we respond to emerging issues. So for example, the emergence of the Delta variant and what that might mean locally. And then we focus on very locally specific issues, whether those are particular geographical, demographic, language, literacy related issues that might be emerging locally that require us to have a more bespoke comms approach. Next slide, please. And as with any comms strategy, you look at your audiences, your messages and your channels. So just a reminder, in terms of audiences, the same person can belong to many different groups. And when we were thinking about both testing and vaccination, we need to think about people who live in Reading, work and study. They might do a combination of all of those things. Younger people and older people might have different needs. People have different language needs. They might have different behaviours or practices related to their particular ethnic or cultural or religious group. And then there's clearly specific situational groups such as schools, students, parents, businesses, employees. In terms of messages, as we said, we're focusing here on the surge testing, and we'll come on to vaccination shortly. And then the kind of channels we have available to us. So we use the local media. We have the council's channels, which are our website, our social media channel. We're able to write to people. We're able to email people. We can also use physical spaces. So these could be billboards or digital signs. And we've also recently been using ad vans, which are what they say, they're literally vans or bicycles, but more often vans, which the whole of the back of the lorry, instead of being full of your Tesco shopping, is just covered in an advert, and we can drive it around target areas to share a message. And we've also been working through relationships and partners to make sure we share messages, whether that's via Brighter Futures for Children and Reading UK, or with the university, the CCG, the hospital. We've been doing a lot of relationship work as well. Next slide, please. So specifically on the testing programme, we used our residents' email. So we were able to email a very large number of people who live and work in Reading, but we also did some targeted stuff. So we started off by emailing just people who had those target postcodes, RG13, RG15, 6 and 7. And we also wrote those people a physical letter. So everybody living in those postcode areas received a letter through their, on paper with a stamp through their letterbox as well. That was how we made sure that everybody would hear about it directly. Next slide. We use those broadcast channels. So this is an example of social media. It was really noticeable when we launched the surge testing programme that engagement on it was really high. So very quickly, the page on our website became kind of the, it went from not being there at all to about 20% of the people who were visiting our website were just going to that page to find out about surge testing just in those initial days. And similarly with our social media, I've circled some of the engagement. So at the point I took this, we had 81 retweets, 8 quote tweets and 46 likes. That's lots higher. That's sort of 4 to 8 times higher than the average engagement we might see on a post, and lots of comments on it. So really it caught, people saw it, and it kind of caught their attention, and they shared the message when they saw it across all of our channels. Next slide. And this is just an example of that sort of location-based targeting. So the two, I'm sorry, they're a bit grainy. The images at the top, these are these ad vans that I'm talking about. So these are the lorries that we drive around the specific target areas. They have large digital screens on the back. It means we can either change the route or we can change the message at very short notice. And you'll see from the van on the left that we also were able to rotate messages in different languages depending which neighbourhood we were in. So for this campaign particularly, we had vans in Polish, Urdu and English going around the target areas. What you can see in the bottom left is a box with 1, 2, 3, 4, 5, 6, about 8 different language options that we print now on our print communications. We also have had it on the bottom of our emails, and it's on our webpage, letting people know that if they want the information they're seeing in another language, this is how they get in touch with us. So we're putting out so much information, we can't always translate everything at the point we put it out, but we're making sure that this message is really clear how you get in touch with us if you do want it translated. And then the letter that we sent to people that I mentioned on the previous slide, so everyone got a letter through their door, we did translate all of those letters and made them available to our community outreach officer, so she was able to give out translated materials, printed copies if people requested it. So those are some examples of how we promoted the surge test programme, and Mike can tell you if it was successful or not.
Thanks, Nikki. So here's the basic data for some of the businesses and hospital results that you can see. It gives you the details of the amount of kits that we collected. So you'll see, of course, that the businesses did take a bit of a hit on their results from some of the collections, which we didn't get back that we were expecting. The schools, though, were generally very, very helpful, and a lot of those kits came back. Hospital, amazing help there in delivering testing and getting those kits back. And you see as well in terms of the town hall, we had an awful lot of return rates for those kits as well. So overall, we've got about 56% from those sites in terms of the results, which is generally very good for surge testing effort. And then when you add in the residents, which we'll come on to, yes, you see then that we've got the test numbers coming up at any sites is up to 15,000 out of our, if you remember, population strategy at the very beginning of about 30,000. So yes, we're up to about 50% return in total across residents, businesses, schools. So a very good result indeed for this additional testing effort. Next slide. Oh, I should point, of course, out there, one of the key details is the fact we did identify 49 positive cases. So that's 49 households where we were able to take some extra measures to put those into self-isolation and supporting them to make sure they're not passing the Delta variant around the borough. Sorry, that is a very important point of doing the testing, of course, is to find those cases, and we did find them. I think we generally raised awareness as well of the Delta variant and helped in the borough be very alert to the risks from the Delta variant. And then, of course, partway through that surge testing initiative, in conversations with our colleagues in NHS, we were offered the availability of an extra support, which was surge vaccinations, extra vaccinations for Reading, which of course we said we would be immediately happy to take on. And so we made some arrangements for that walk-in clinic to start. And I don't know if you've seen the communications on that. Nikki might talk a bit more about that. But if you've been into the council offices, the civic offices in Reading and Bridge Street, that's where it is located. It started on Thursday, the 17th of June, and it was initially scheduled just to last for those 10 days ending on the 25th of June. It has been extended. Oh, I thought I changed that date earlier. It was extended to Friday, the 2nd of July today, but it has now been extended for a further week. It's now extended to next Friday, the 9th of July. And originally we set it up to support the RG1 postcodes additional testing. That was the criteria, but very quickly we changed that, and as of the 22nd of June we were able to allow anybody in Reading 18 years of age or over who had not been vaccinated at all, who was therefore waiting for their first dose. They could just walk in, no appointment was needed. So an awful lot of effort went into communicating that, and we've seen some good results in terms of the numbers of people coming through. Nikki, if you could progress on our next slide as well. So far, what you can see is these are the numbers who are coming in. So we were planning for 240 a day. That was the estimate of the number of vaccinations that we thought we would be able to deliver. And that is the resource which our NHS colleagues made available to us. It's been an excellent collaborative effort so far. It's working extremely well downstairs in the civic offices. The council is supplying the premises, the security staff, the marshals, the NHS, of course, are doing all the clinical work in terms of administrators of booking people into the NHS systems, taking people through for the vaccinations, and then together we're all seeing them out the other side of the system all safe and well and vaccinated. So you can see that the numbers there have been around that 240 mark, that we have had days where we've gone as high as 317. There was one day 150. That was a very low day, but just to say there is an issue on that day in the sense that one of the vaccinators had to be redeployed partway through the day, so we had less capacity to be able to do it. We have seen the numbers slightly dipping Monday or Tuesday of this week, but they are starting to pick up again, so hopefully for the weekend they will pick up. Perhaps people have thought it was going to finish on last weekend, so there was an initial rush to get it done on the Saturday and Sunday, but the word of mouth has been excellent, because what we are doing is asking everybody who comes in to tell all their friends and family about it on their social media, and that's worked generally very well, especially with the university students. Word got around there very quickly, and I think the initial ones who came through were all the sort of university students, where we also engaged with the university directly to make sure that they knew that the service was available here, and there was one in Wokingham as well, which is now finished. But since then, of course, the word has got out generally, and we're seeing a very diverse group of people downstairs coming through to get their injections. So next slide, please, Nikki. Nikki, do you want to take over on that?
Sure. So again, I won't go through everything that we did because there's some repetition with the surge testing. But again, social media was really popular for this. So we really got a very high engagement, particularly with the vaccination centre. We were doing live updates. So we were able to tell people whether the queue was very long or whether it was short, whether now was a good time to come. And we saw those posts get shared a lot more than our posts normally would be. So people were seeing them in real time and sharing that information, or they were tagging their friends and saying, you know, this is something you could do, or, you know, good opportunity for you. So social media worked really well for promoting this, particularly when with that younger age group, which were the real target for this, because it was open to 18 plus from the day before, and then just in those very early stages of the national system also being open to 18 plus. Next slide, please. So just to try and highlight some of the other things that we did that I haven't mentioned before, so I've circled there. This is, you know, the university promoting the scheme. So as I said, we did as much partnership and relationship work as we could here. So as well as our own channels, other people, other organisations were also promoting the service. In the top left is a BSL, British Sign Language, video sharing information about the clinic. So again, we were trying to make materials as accessible as possible. And also we were linking in with the national campaign. So you might remember that last weekend was this national grab a jab weekend. So there was a big NHS push across the whole country that everyone should go and get their first vaccination, and we tied our materials in with that, which again, we had a bit of a bumper weekend last weekend from Mike's figures, partly because we would have benefited from that national coverage that was happening as well. And again, bottom left, we also used our residents' email, so going out to 100,000 people. And as we've gone through COVID, we've seen in terms of the number of people who open and read our emails, it's always been the case that we have quite high numbers, then people start to get bored of the message, and then we get a brand new message and we go back up to higher levels. So where we'd been talking about what the ongoing rules were, we were seeing a bit of a drop off in terms of people who were interested. And as soon as we did surge testing, and then again, as soon as we did surge vaccination, we saw open rates and engagement rates with our emails go right back up again. Next slide. But this was just to say something about context. So as we approach Freedom Day on July the 19th, and we've already sort of had one aborted Freedom Day and we're moving towards the next one, we are in an increasingly busy space when we try and talk about COVID and what we want people to do and promote our own services, both from council. So you're not supposed to be able to, you're supposed to not be able to see what's going on this slide, what's going on. Point being that the council itself has lots of other things to promote, new services opening up, but also there's just lots more going on generally, whether it's build up to the Reading Festival, major sporting events, the Euros, Wimbledon. We had the 40th anniversary 1 year on, there's lots of celebrity news and stories going on. So we are in an increasingly busy environment trying to cut through to get these messages across to people. There's a bit of kind of fatigue with COVID, and can we just get back on with with normal life? And there's just a lot more going on as things open up. So sometimes it is quite difficult to get that airtime. Next slide. And so just to finish from comms, to say the next big thing obviously coming up for us is the 19th of July. So we expect confirmation on the 12th of July whether or not the sort of final relaxation of the rules is going ahead on the 19th of July. And to bring us back to that strategic framework, so we'll be focusing on making sure we're amplifying whatever the national messages are around what's happening on the 19th of July. And those are both kind of the government rules, but also other key campaigns by partners. So, for example, the NHS has run significant campaigns around things like we're open and open for business as usual. So it will be those government rules messages, but also other key partners and their messages. Whatever the implications might be locally, therefore, whether we're continuing with community testing, for example, and how you access it locally, those kind of things. And then there will always be these kind of micro ongoing issues locally. So it could be hotspots of infections, or it could be areas where there's low vaccine take up, where we'll want to be really kind of targeting local communities to get messages across about what we all need to do to stay safe even after July the 19th. I think that's all from me, Nikki, unless you want to surprise me with another slide. No, that's it. Thank you.
Thank you, Chairman.
Thank you. No, thanks for that. That's really helpful. Katie Summers, did you have anything to add? You suggested earlier you'd like to comment.
Yeah, so just building on, and as a big thank you I want to give to both Nikki and Michael for actually helping. But it's not just Nikki and Michael, it's everybody in Reading Borough Council to set up that surge pod. You turned that around in 48 hours. That is amazing, and it's a big thank you on my part. But it's not just for me, it's across the whole of Bob for you to actually stand that up. It's been a really good piece of work, and there's some really good learning for us in actually how we can start to link up more closer together going forward. So just want to say that. Just also to state that actually on quick dive on vaccinations. So just to give people a bit quick summary, we're still continuing with sites in both the Tilehurst Primary Care Network, University Primary Care Network, as well as West Villages, as well as what's the other one? Well, Waterman's House is just going closing. In pharmacies, we've also now got pharmacies of Triangle Pharmacy, Western Elms, and also Eastleigh Road pharmacies. But this week on Monday, we're opening up Boots in the centre of Reading. So I think that's a really good location, because that's going to be where lots of people do start to congregate after the 19th as such. We're doing a lot of work with comms for that piece going forward, and that actual vaccination site is going to basically see 2,400 people per week going forward. So I feel quite reassured that actually, although we're stopping Watlington House, we're opening up a new centre, and actually it's probably a better centre because it's in the centre of Reading. So just want to create people of that. We've also set up now what's known as a Health on the Move van, and that is travelling the rounds at the moment. It's going across Berkshire, West Oxfordshire, as well as Buckinghamshire. We are going to be doing some distinct sites in Reading. Ailish McCarthy has been working really closely with ACRE, the actual charity, and so we're going to targeted work with the actual ban the week after next. So we're going to do a lot more targeted vaccination programs going forward as such. So I think there's some really good pieces of work to go forward here. What I'm very conscious of is the fact that we need to thank everybody, all the volunteers and all of the actual clinicians who've been involved with this. So what I'm organising, a big thank you to Peter Sloman, as well as the other chief executives across Reading, across West Berkshire and Wokingham. They've given us some money, so we're going to give out vaccination mementos to both volunteers as well as vaccinators to say as a big thank you. I'm also looking to pull together an event to actually celebrate the actual vaccination programme as well, because it's been massive literally over the last 9 months. And as we move forward, we do know, and you probably saw it in the news, that actually in September there's going to be almost like a booster and flu programme. We need some downtime, we need to celebrate, to then get ourselves ready for the next round as such. So I'm wanting to make sure people are aware of that, but as soon as we get the details of that event and conversations about those mementos, I'll make sure that everybody here is aware of that, and so we can actually get those mementos out. Is that all right, Graham? I think Ailish can give a quick summary about door knocking. Ailish, did you want to come in?
Yes, hi. Thank you, Katie. Just so very quickly, we've got so the door knocking been doing in conjunction with Reading Borough Council. So Chris Brooks and his electoral canvassing team have gone out to households starting off in the Oxford Road area, as that was one of the lowest uptake areas. They've so far they've visited 636 households. We're finding, and David alluded to this earlier, one of the biggest benefits of this for us is around data cleansing. And so far, sort of 49% of the homes visited, there was either no answer or they were no longer at this address. So that is a big help to us. We were finding out that 4% of the households had already been vaccinated. 3% were hesitant and 2% were refusing to take the vaccine. So we picked some top level issues around that, where people were planning to book in the future, they were going to discuss with their families, they weren't decided, they'd like more advice, or health issues, and then concerns about safety and blood clots, and then refusal. Again, it was about safety concerns and medical reasons. So we've picked up on some of those issues, and Katie's mentioned about the Health on the Move van. So we've got we're actually going to be delivering an event with the van on the 15th and 16th of July at the Oxford Road Community Centre, which we're starting to publicise very widely. We're billing it mainly as a wellbeing event. So we've got the Reading Borough Council wellbeing team, and we've got 2 qualified nurses from the Royal Berks are going to come down and do blood pressure checks. But we'll be available to give advice, people asking questions about COVID vaccination, and we'll have COVID vaccinations available and we're also going to be working in Abu Bakr Mosque as well. So we hope to pick up people from there. We're so in 2 other areas where there's low uptake, and again, this has been really good partnership working with the CCG and Reading Borough Council. We're planning one at the warehouse by Wycliffe Church, and also at the South Reading Community Hub along the same lines, and we plan to repeat those so that throughout the rest of the year. Or around the flu COVID boosters. And we're also going to be we're working again with the LA local authority CCG, but it's going to be hosted by Health Watch, an online event where we're going to it's called what are your questions on the vaccine now, because we're 6 months in. We're going to be targeting particular community groups where there's been low uptake, but we're also people have volunteered to share their experience. So we've got somebody from the Nepalese community, somebody from the Muslim community, someone from the Chinese community, and they are going to say why they got vaccinated and how they feel after that. So those are the sort of top level events that we've got coming through there. Thanks for your time.
Great, thank you. I think that was really helpful update. So particularly interested in the initial data coming back from the door knocking in terms of the numbers that are no longer there, which isn't necessarily unsurprising as somebody that knocks on doors at election times and in that particular area, and finding that people no longer live at that address. Okay, thank you very much. I think going back to the initial bit around the communications, I think we need to reflect a little bit in terms of the national messages. We don't know what they're going to be, whether they're going to be appropriate to Reading. And I know in the past they haven't necessarily been, how can I say, as effective as the local stuff being put out. So very much appreciative of the local messaging. I think it's been much more effective in Reading than the national messaging that's gone out. So thank you for that. The final, I don't see anyone else indicating, the final item is the control plan development. David, would you like to?
Yeah, thank you, Chair. So back to me again for this item, and really what I wanted to do was to just really show the kind of the forward look as to what we think's kind of what we know is happening next, what we think is coming next in terms of our kind of outbreak control work here in Reading and how our plan kind of will need to adapt. So there is more that we could have said on vaccination, but we touched on that quite a lot, and obviously maybe for a future board meeting touching on then you know, booster dosages, who that's for, how it combines with flu, etc., may well be an important one to focus on for future meetings. But there was just 3 bits I wanted to cover off for today. So Nikki, if you could move on to the next slide, please. Really, it was just to kind of say, and it might feel a little bit like a statement of the obvious, that clearly we need to continue to have our eye very closely on variants of concern. I've referenced them a bit before, talking about the change from the Alpha variant to the Delta variant, and we can see on the graph here just kind of what's happened a little bit kind of nationally in time. And the only reason for showing this, and this may also in part be interesting, Councillor Robinson had the question regarding a variant earlier, is the very light shading that is almost white is the kind of Alpha variant in each of the different regions, and then you can just see that the kind of the square becomes so much covered by the Delta variant shade, that kind of lighter purple in each of the regions, and just how quickly a variant can, you know, the profile can change from prevalence being of one variant to another. But you see, particularly, you notice in London, you see it in the southwest, you see it in the southeast. You can see that there are other variants that are kind of ticking along all of the time, and we would have been saying that about what at the time we were calling the Indian variant not that long ago. So it was really just to say that surveillance of variants of concern remains a really important part of local response work, and ensuring that we do identify and we do the contact tracing and the isolation where those variants arise, and, you know, targeted testing again if that is required, even if it's not on the scale that we've just heard about earlier. So that's probably the main thing about the variants of concern. But to kind of, I guess, provide assurance to the board, every PCR test, the lab-based test that is undertaken by a resident of Reading, automatically goes for full genetic sequencing, so that the labs can see not simply just the S gene bit that I referred to earlier, but can see exactly which variant has caused the infection, you know, if of course the test is positive. So Nikki, if you move to the next slide, please. Clearly, variants of concern is closely linked then to returning travellers, and, you know, we've talked a little bit about the 19th of July already at the board meeting today, and I'm fairly confident, although, you know, I guess we're all waiting, aren't we? But I'm fairly confident that on the 19th of July we won't see a scrapping of either the traffic light system or something similar in terms of returning travellers, and what that means either in terms of testing, in terms of isolation, etc. And clearly we've had a challenging experience in Reading with a local quarantine hotel facility for people returning from red list countries, and I think it's going to be very important as we move through the summer and into the autumn that we are able to continue to manage where people return from countries where it's higher risk that there's variants of concern they could have inadvertently become infected by. And one of the things that we want to see more of is availability of the data, so that we know kind of on a day-by-day basis who's in Reading, and based on their travel history it has to isolate at home. Currently that's organised nationally, and there is national door knocking that happens to ensure that people isolate. But I think the next step is that locally we are better sighted on that, and that's really so that we can do that surveillance piece more, because of course if we know that there are people in a particular part of town where they have returned from a country where there's a variant of concern that is circulating, and we start to see rising rates in that area, that's the very first indication to us, of course, isn't it, that you don't need genetic sequencing to tell you that you may have an issue there, and we need to kind of act swiftly. So I think that's the next bit in terms of returning travellers. But of course, that needing to be nuanced by, well, what if people are fully vaccinated? What does that mean? And does it, you know, is it that there's a different approach to people are fully vaccinated versus those who are not? So that feels like a bit of the next step on variants of concern and travellers. So Nikki, if we move on to the next one, please. And then just to say, really, the targeted lateral flow testing. So we've spoken before at this board about the lateral flow testing programme and how that is kind of working in Reading, and it's evolved and changed several times kind of since it's kind of come into play. What we're being asked to do now at the stage of the pandemic we're in is to ensure that we continue to have a lateral flow testing offer. And just to be clear, these are the tests that people can do either under supervision or just in their own home and give a result in approximately 30 minutes and work in a very similar way to a pregnancy test. So what we're being asked to do is to ensure that groups who have been disproportionately impacted by COVID, or we know generally in the health setting are underserved in various ways, are have the engagement and the targeted support for lateral flow testing. And some of those groups that have been listed out for us nationally to focus on are listed on the slide there. I won't read them all through. So the next step for the lateral flow testing program is about targeting it. We continue then to have a community collection scheme that's working very successfully in Reading, and there's a high collection rate, and primarily we'll be looking to people to use our local pharmacies and also to order those in the post, and then school and university and colleges provide them directly to their pupils and students. We've converted the town hall now back to a lateral flow testing site, whereas we had used it for our surge testing effort for those PCR lab-based tests earlier in June. So that's now back for supervised testing. And then it's really about then reviewing what we need still in terms of fixed site supervised testing, and where actually a more mobile option may be useful. You've heard about the vaccination van already from Katie and Eilish. So, you know, to be able to support certain communities or targeting of testing, you know, having a mobile offer may be the helpful way to go. And you know, guidance is awaited. I feel like we said that a couple of times already at the board meeting today, haven't we, regarding schools and universities and testing for September. But actually, we've had communication through from the Department for Education about them resupplying test kits and PPE, etc., so that for September, schools and universities are ready to do testing, albeit not clear exactly what will be asked for yet, but trying to get that infrastructure in place ahead of time. So that's where it looks like kind of testing is going for the kind of, if you like, for the next stage, and our plan needs to kind of adapt and reflect that. And then the final thing for me then is about long COVID, and just to say that this feels like, again, an area that's kind of emerging more in terms of its importance and in terms of our understanding as well, and again needs to be part of what we're working on, you know, as we take the forward look. I think it's fair to say it does remain poorly understood in terms of defining exactly what we've listed, what some of the symptoms that are often reported are here. But there isn't an agreed diagnostic criteria. It's not something that we routinely record or code within health records. I don't think we understand that well population susceptibility. So does it primarily affect older or younger people? You hear kind of different reports about that. There's not conclusive evidence on that. And of course, you know, how it's treated and most effectively managed will kind of evolve and develop in time. In terms of the prevalence of long COVID, the best data that I've seen on that is kind of self-reported symptoms through an Office for National Statistics survey, showing that between 1 in 9 and 1 in 10 people who have been infected with COVID and have had a positive PCR test report at the 12-week mark after infection, they still have symptoms that are extensive enough to affect their normal day-to-day activities. That's a much higher proportion when you look just at those who have been hospitalized with a positive COVID result, whereas many as 1 in 2 would say that they 12 weeks later still have some kind of symptoms of that are lingering, which as I say, being referred to as long COVID. So again, this is one to watch, but not simply to watch and be passive. I think it's about trying to understand what this means in Reading better and what the impacts and prevalence are locally. But I think that some of the kind of national research on this is underway, which will of course kind of apply and feed into any of our local initiatives. So Chair, that's it from me in terms of the kind of the next steps for our plan and what we should be doing in Reading. But again, happy to take any kind of questions or comments on that.
Great, thank you, David. I think that was pretty thorough. Any questions? Any points anyone wants to raise? No, I'm not seeing any there. I think you covered it all there, David. So thank you very much. The only thing I think left is the date of the next meeting. Nikki, is that on there? I think it flashed up. So quickly, date of the next. There you go. So we've got the date of the next meeting down for Friday, the 3rd of September 2021, and the only thing I think I can guarantee is we've got no idea what the situation will face us by the time we come around to our next meeting. So thank you, everybody, and thank you for the everyone that's indicated. Oh, I've got Katie Summers.
Yeah, sorry, just coming up, I just need to just double check something. David, on that long COVID, do just make you aware that actually the NHS have just literally released a long COVID enhanced service piece. So I'll send you the link, but actually this is one thing that actually GP practices will be asked to be doing as such. So I think actually probably what we could be doing is actually having a wider conversation and linking you in public health with the GP practices about how that's going to be rolled out. But it's quite clear in here if I send you the link, David, so you're aware of it.
Great, thank you, Katie, appreciate that.
Thank you, Katie. Right, in which case, thank you, everybody. Thank you all for attending, and hope, well, so I think it's been mixed weather this weekend, so enjoy the sun if you can ever find any. Great, thank you very much. Thank you.
Thanks, Graham.
Thank you.
Thanks, everyone. Thank you.
Thank you. Bye.